All right. Welcome, everyone, to another Psyche Innovations webinar. Thank you for joining us. I know this is a break from our usual time, so I'm grateful that you can join us. We, of course, had to accommodate our wonderful guest, Kieran, who is joining us from Australia late at night, doing us a favor with his appearance. So thank you very much, Kieran, for joining us. Right, so what are we discussing today? The topic, health tech tools, fad or future for practitioners. What a catchy title we came up with. And who do we have with us today? Not just a handsome man, but he's got brains as well. We have Dr. Kieran McLeod with us. He's a South African medical doctor and health technology leader with a background in emergency medicine and field hospital experience, including working with Médecins Sans Frontières, which is really cool. I'd love to do that. His journey into health tech has included advisory roles, as well as founding and building ByeGwaai, which is a mobile app-based smoking cessation program. So helps you stop smoking, really cool. And Kieran's now based in Melbourne in Australia. He heads up the medical knowledge team at Heidi Health, where he specializes in prompt engineering, clinical safety, and product management for Heidi's AI-powered medical scribe. Thanks for joining us, Kieran.
Awesome, Dan. Well, thank you very much for having me. It's great to kind of come back, I guess, to my roots and chat to some fellow South Africans who've gone off the beaten path and decided to dive into health tech. And yeah, I'm very keen to chat to you about like how building the tools that you and I are building are actually helping healthcare practitioners, do their work that little bit better and obviously care for their clients and patients as well.
Absolute pleasure to have you, Kieran. So how we're going to do this is Kieran and I are going to ask each other some somewhat prepared questions just to try get some cool answers out of each other. If you have any comments, please send them through. Hopefully they'll pop through. We're doing this on a new streaming platform, so hopefully it all goes to plan. So we're just going to start off by giving a little bit more context about what we do. So Kieran's just going to talk about what he does at Heidi Health and what their core product is. And I'll do a little bit about the same for Psyche Innovations, and then we'll jump straight into those questions. So thank you for joining us. And Kieran, take us away. Tell us a bit more about what you do.
Cool. So for those of you joining who don't know anything about Heidi, we are an Australian-born health technology company who's been around for about 5 years now, originally starting out in the medical education space, then kind of moved into practice management software for GPs, and always kind of focusing on trying to build AI tools for clinicians. And about 2 years ago, we decided it was time to kind of enter the AI scribe space. I think ChatGPT had kind of catalyzed this AI revolution around the world. Suddenly it was mainstream. And we felt that was when the time was right to really dive in and double down on it. And so what Heidi does in a nutshell is essentially transcribes the conversation between you and your clients or your patients, takes that transcript, combines it with a large language model, and basically helps produce clinical documentation. So notes, referral letters, patient explainers, you name it, Heidi can do it. And along with that, we're kind of building on that sort of base foundational, that base feature of note generation, and adding things like coding, as well as sort of call agents who can help manage some of the more administrative tasks that are associated with clinical medicine and clinical work as a whole. So from my side at Heidi, I run the medical knowledge team. We're essentially a bunch of clinicians with some technical skills, and we're there to sort of help do the prompt engineering, which is essentially how you instruct the large language models to write your documentation, making sure that the right safety guardrails are in place. We do, again, a lot of clinical safety work, so making sure that our engineers and our product team have put the right controls in place so that this AI doesn't go wild and start making up diagnoses or management plans or anything like that. And then last but not least, work very closely with our designers, our engineers, our product managers to ensure that the product that we are building is, fit for purpose, and that, the clinicians who are using it, love the features that we've put together. But yeah, I think it's great to, be able to chat to Dan, because he's obviously put a fair amount of blood, sweat, and tears into a Psyche and Psyche innovations over the last little while. And yeah, very keen to kind of talk through, what it's like to sort of build products for clinicians, because there's no doubt that, these kinds of tools are absolutely necessary. But at the same time, building for healthcare providers is incredibly challenging. And yeah, keen to kind of dive into the meat of it with you.
Oh, thanks for sharing so much about what you're doing, Kieran. It's really interesting and super cool. And their tool is really useful. I really encourage you to go check it out and learn more about what they do. So yeah, I'm looking forward to the engaging questions. So for those of you who don't know who I am, I'm Dr. Daniel Page. My background's in psychology, as well as molecular biology. I've been in the NPO space, founded a nonprofit, and then most recently founded Psyche Innovations, where our whole thing is about making mental health or evidence-based mental health promotion skills and resources accessible to as many people as possible. And we do that through the Psyche Mental Health app, as well as our human-centered services. So the Psyche Mental Health app can be used by individuals, teens, and adults, as well as by organizations. So that's schools, universities, businesses, and in the sport and wellness space. And then what the app actually does is it helps people to measure their mental health and well-being, learn psychological skills that are personalized to them, and set sort of therapeutic journeys through their practitioner, if that's appropriate, through setting goals, because we have a whole goal-setting feature, and we're also about to venture into the AI space. Not doing what Kieran's doing, that's like there's no competition, but creating an AI journal that helps people reflect and learn more about themselves. So yeah, Kieran and I have some shared sort of experience in what we're doing. I really encourage you to go check out what we're doing at psycheinnovations.com, as well as Kieran at HeidiHealth.com, I believe. But we'll drop all the links in afterwards so you can find it. So our approach is also around helping practitioners and individuals thrive, giving them those evidence-based skills and being more holistic. So that is our whole shtick. So we are going through a fair amount today. We have a whole bunch of different sets of questions that we'll try tackle. So I think let's jump straight in. Kieran, this question is for you. How can digital tools like Heidi and Psyche help practitioners create more mental space to be present in their work?
It's a great question, Dan, because I think, the first thing people think of when they talk about a digital tool in the healthcare space is they think about like the electronic medical record. It is like the quintessential digital tool that is used by, doctors to OTs to psychologists. Everyone who works under the banner of healthcare is familiar with the electronic medical record. And I think in many ways, when it was first introduced, it was this, cast as this idea of like, oh, we're going to have all of this patient information centralized, and it's going to mean that we, can track our patient's history, back 10 years or 20 years, and we never miss out on anything again, in the way that we did with paper-based records. But with it has come probably one of the biggest challenges of healthcare, which is documentation. And I think the stat that jumps to mind is that clinicians often spend more than 50% of their workday doing documentation. And Dan, I mean, I'm sure it's the same for you, but we didn't go through all those years of training to be, administrative workers. Like, we came here to help people, right? And I think for many, like, the electronic medical record has kind of become a foe. You're not necessarily concentrating on the patient or the client in front of you. It's the sort of T-Rex arms, and you're typing away at the computer and then turning back to ask your next question. And one of the, I think, reasons why a lot of people enjoy using a tool like Heidi is the fact that it lets you kind of take your hands off the keyboard, concentrate on the patient and the client in front of you and actually just talk to them, kind of safe in the knowledge that your notes are going to be written up for you by the time that conversation ends, and you haven't had to click, more than sort of 2 buttons, and you haven't had to touch the keyboard at all. And I think patients really, benefit from you actually not concentrating on your computer and then moving back to them. And I think particularly so in the mental health care space, where, clients are often coming to you with, troubles or trauma, and what they really want is somebody to be sitting across from them who's really engaged and listening and, empathizing with what they're going through. And often it can feel a bit disconnected if you're constantly playing on your computer the whole time. So that's one of the ways I think that, Heidi is certainly trying to help in that space. And yeah, I'm interested to hear like a little bit more about what Psyche's doing on this front, because yeah, I think if you can reduce that cognitive burden of having to do all of these like administrative tasks that are associated with care and just focus on the patient at the time, that makes for a much more engaged and hopefully happy clinician as well.
Yeah, I completely hear that. And I think at the core of it is, any solution needs to solve a core problem. And there's a few core problems that people are willing to pay to solve, to make their lives easier, to reduce hassle, to save money. And I think at the core of it is giving people the time and space back to do the meaningful work without adding extra burden, I have to use this and add that and whatever. And we talk about integrating things into workflows. Well, hopefully we'll talk about that a bit later. But that's the core of it, is so that the client as well as the practitioner can be present. It's not distracting from that. It's only additive or making life easier. And your AI scribe does that, and the approach we take is that as well. You use it in intelligent ways that don't add extra burden. So that's the thing we always try to keep in mind with whatever we're building, whatever problem we're trying to solve. It mustn't feel like work. Nobody wants a bad hammer that makes the job more difficult than not having it, I guess.
Exactly. And I mean, I'm guessing like a lot of the like tools that you built to assist clinicians are taking away some of the time and effort and mental load they would have when they're sitting with a client in front of them. And again, maybe you can speak more to the details, because I don't know Psyche inside and out, but you're thinking, right, this is a client who would really benefit from a tool, the CBT homework, this kind of exercise. And the last thing you want to be doing during that session while you're trying to engage with them is trying to find something online and then print it out for them to take home, or like half emailing it to them at the time. What you want to be able to do is like, cool, I know that I've already got this collection of tools available to me that I can just quickly access and hand over to the client, and it feels seamless. It doesn't feel like you're having to jump from one thing to another. But yeah, I'm actually keen to learn a little bit more about like what kind of tools you guys offer and how that might sort of help the average clinician reduce that frustration of trying to find the right tool at the right time.
Yeah, 100%. I think that's one of the key things. And I think it also comes down to trust. You want to know that the tool you're using is trustworthy and is evidence-based and that there's no risk. And once that kind of like key box is ticked, it's like, okay, well, is this tool doing something smarter, right? Because like there's the first person who came up with the hammer. I don't know why I'm going to the hammer today, but there's the person who came up with the hammer. Now there's probably like machines that hammer things in, right? So it's finding the tool that fits the problem that you have, and then creating it in a way that it doesn't disrupt your work, that it's pretty seamless. So that's one of the key things. And then I think what we try to do a lot is personalization, because I think in the past there's been like a lot of tools, and now people want to feel that it's relevant to them, that it adds a lot of value to their specific practice or their approach or the people that they're serving. And that's something we try to do quite well with with the assessment tool that we have, so people can learn more about themselves as individuals or in a therapeutic relationship, and practitioners, so clinicians or wellness practitioners or whatever, can use that to gain that detailed insight, and that allows then for more value to be provided, because in healthcare you want to treat the right thing in the right order, right, and also be able to show that you're making progress. And this is particularly true in mental health care, is people often feel stuck and they want to know that they're making progress and be able to see something that's often not so tangible as in other spheres of health. Like viral load, if it goes down, that's quite clear. You can shout that out. In mental health, it's a bit more tricky. So that's also something we try to keep in mind. And I'm rambling here, but I think it also comes down to empathy with the problem, like really trying to understand what is it that are the core challenges that practitioners and the people that they serve, their clients or whatever, that we're hitting those things and not sort of peripheral things. Those are the things I try to keep in mind. What about you, Kieran?
No, I mean, look, I think that makes a lot of sense, right? You want to try and tackle the problems that they're going to see on a regular basis. Like, you don't want to solve a problem that is too niche, because then no one's ever going to use it, right? You want to solve the problems that they're facing kind of day to day. And if there are evidence-based tools out there that are appropriate for either their particular style of therapy or engagement with the patient, you want those to be available to them rather than kind of esoteric, strange tools that may have been validated in some other part of the world or in some other form of therapy, but maybe don't make enough sense or the right kind of sense for the practitioner who's using those tools.
100%.
But yeah, I'm interested because you spoke a little bit about tools being supportive, and I think we touched on you don't want this tech sitting in the room to be a distraction. You don't want it to be disruptive to the workflow. Like, how do you, I guess, think about building a tool that is supportive rather than disruptive, particularly in something that can be as, like, I guess, sensitive as a therapeutic session or like a therapy session? Because it's one thing if it's a computer sitting in a doctor's waiting room and you're coming in because you've stubbed your toe. Maybe you hit it with a hammer. But when it's a therapeutic relationship, and you're perhaps going through some complex trauma, and you're wanting to build that trust, you've got to have something that, as you say, is kind of seamlessly integrated and supportive and not a distraction. How have you sort of thought about that?
Yeah, I think it leads into a question that I'd like to discuss with you around how we design tools that are appropriate and relevant and are suited to clinicians. And that design discussion, I'd love to get your insight on that next. But that's really what we're kind of considering, is how are people already working, right? So it's doing user testing or market research and speaking to practitioners to kind of learn, well, what are the snags? What are the challenges that you see in the work that you're doing? And if we had like all these problems, what are some of the core ones that you would want solved? And kind of like, making a hierarchy of those things. And because the value that you provide to a practitioner, like, they have to see it, they have to feel it, they have to be willing to pay for it. When we think about health tech and creating tools that people want. And like, you guys have niched down on like a very specific challenge, and like, you're a nuclear reactor for a specific problem, in my mind. And we're more like a toolbox with a whole bunch of different things that solve different problems. So it is kind of different. And I had this discussion with a clinician at UCT literally just before this, and he was talking about, the tool, I can see it being like really valuable in session 3, because that's when I think providing these psychological skills that we have would make a lot of sense for him and the way that he practices. And that's the thing I like about what we're trying to do, is that different practitioners will use our tool in different ways that fits their therapeutic approach, right? and they can tell when it's relevant to use it, because you might not want to come out on day one with a hammer and go bonk. The nail might present or whatever later on. And I think something that we also have to keep in mind is that people respond to technology in different ways, right? Some people love it, some people hate it, and we can dig into that and why. But we try to provide a range of tools that different practitioners with different approaches can find relevant and beneficial. And I think there's also a bit of education there in teaching people how to use something. Like a lot of tech has these demo videos, how you use this and how you integrate it. That's super important because, like I often joke, being mean, but my mother has a phone that can do a million things and she uses it to do just one thing or two things. So that's also the thing, is creating something that has diversity of functionality. So that's how we kind of think about it. And I'm curious how you think about designing in a human way so that tools work with a practitioner rather than against them.
Yeah. Look, I mean, I love the analogy of the toolbox, because again, it also fits, back into the hammer analogy as well. But I think you're so right in that you want to, you understand that you can't just, there's not just one solution that's going to be absolutely perfect for, a therapeutic relationship. You're going to need different tools for different people, and you kind of have to build something that's got those different tools available so that, you can go to your toolbox and find what you need when a particular type of client presents to you. And I appreciate the kind of nuclear reactor analogy. That's probably giving us more credit than we do. But I think in many ways, I guess we've looked at that problem in a similar way to sort of how you would look at your phone as well, right? We've tried to sort of build it so that it's relatively simple and easy to get started for the tech averse, 60-something-year-old clinician who hates the EMR and hates the idea of having to learn to use a new piece of technology, but that to get started with a tool like an AI scribe, it is literally just a matter of, logging in, starting a new session and clicking transcribe, and then clicking stop at the end, and the note gets produced in front of you. And the beauty of it is that at a very simple level, you automatically or almost immediately see value being produced. I have saved myself, 5, 10, 15 minutes, perhaps longer worth of typing, just from clicking 3 buttons. And that's why we've sort of designed, simple. You can get started, you don't have to be technically savvy, but you can still get value from the product. But then for the user who's kind of more interested in understanding how I can get the most out of these tools, that's where we sort of built, I guess, a slightly deeper feature set where, you have a power user who's like, well, I want to be able to do something else, right? And I think, one of the ones which, again, I'd still consider to be a relatively basic feature, but, not everything is verbal. And again, no more so than in like the mental health care space. I mean, I'll go to the extreme here, but, when I was seeing, working at Victoria Hospital in Cape Town, we would see obviously a lot of acute psychiatric presentations or acute psychosis presentations. And I certainly wasn't going to verbalize out loud that I thought the patient was psychotic, right? Or that maybe they were lacking insight and judgment. And therefore, we wanted to give people a space to be able to write sort of non-verbal notes that could then be incorporated into the AI. And then people started talking about, well, what if I've got kind of a certain way that I want to, write my examination findings? And that's kind of where macros then come in. So you can add a shortcut to quickly add things. And, then, I want to get my notes to look and kind of sound the way that I write, templates. And so there are these sort of features that sit underneath the surface that for the user that's keen, or the clinician that's keen, they can go and discover it. But you're still getting value from the product even without all of those extra features. And you'll find that from one clinician to another, one specialty another, they get completely different, they use completely different features and still get an enormous amount of value, even though they're not using like the absolutely full feature set. And I think that's actually the mark of a good product, right? Is that you get value from just basic, simple use, but the more you engage in it and the deeper you go, the more value you get out of it. But that, you still are targeting like the lowest common denominator who's not going to go too deep. And that's how I think we should all be thinking about design. You can't be designing a high-tech product that is just marketed to the 20-something healthcare professionals of tomorrow, because firstly, they don't have these established practices that can afford the tools, at least not yet. You need to be able to cater to clinicians across the board. And yeah, I think that's how I would want to think about designing healthcare. You need to design from 25 to 65 and every clinician kind of in between. So yeah, but I'm interested, maybe, just because we're kind of talking about engagement and stuff like that, maybe just to kind of talk a little bit about, moving from engagement in products to engagement between like clinicians and patients, because I think there's perhaps some lessons that are shared between engaging patients. So I'm imagining that there are quite a few patients that maybe, disengage between sessions. You see them, week to week, and then suddenly you don't hear from them, for a month, maybe 2 months longer. Hopefully they don't come back in crisis. But, how do you think about how we can maintain sort of momentum to, deepen that engagement with your clients?
Yeah, it's a great question. And ultimately, it comes down to a core problem for both clients and practitioners. Because obviously, practitioners want to see their clients through the whole therapeutic journey, both from an improving mental health outcomes perspective, but also from a financial perspective, especially if you're in private practice, right? And clients want to stay engaged. They want to commit to it. They want to see improvement. So it's really a core challenge on both sides. And how we try to think about solving that also kind of echoes what you were saying earlier, solving some of the core problems, making sure that it's easy to use, that we're constantly iterating and including new features and trying different things out to see how they add value, experimenting, right? And at the end of the day, if somebody feels that a tool's personalized, that it's relevant to them, that it adds value, that they want to keep engaging in the process, they're going to commit to the journey long term, right? Because nobody wants to go to a doctor and they feel like, oh, I don't think this is actually making a difference, and it's a problem across health, but I think it's particularly bad in mental health care. I mean, the numbers of people who don't finish their courses of antibiotics is insane, and that's often just 5
days.
Yeah, exactly. So that's one of the core challenges that we're trying to solve, that people feel that they're making progress. And we're seeing that, and people are investing more in their care, and it's really a pleasure to see that. So yeah, that's one of the core things that we're trying to do. And yeah, I think the more, I think, one of the other things is, there's this huge space between seeing your provider, right? You might see them once a week, right? And you see them for 30 minutes to 90 minutes, somewhere between there, depending on the approach or whatever. There's a lot of space in between. You're forgetting what was taught to you. You're forgetting how to implement strategies. You're forgetting what goals you set or what you agreed on, or whether you're supposed to be journaling if you're actually doing it. I'm guilty of that as well. Like that's part of why we're creating an AI journal feature. So I rocked up and sorry, I didn't, so
I didn't do my homework, basically.
Exactly.
That's maybe the feeling that they get, but you don't want them to feel like, oh, I'm arriving to class and I haven't done my homework. Then they come in with guilt and shame. Like, you don't want that. You want it to feel like, oh, we're both investing in this relationship and the time that we're apart. And, you need a way to make that easy to do, right?
Yeah, exactly. So seamless, doesn't add too much hassle, is easy to use. Those are the kind of like core challenges. And I think anyone in health tech is really trying to solve that problem in just different ways, whether it's, drones dropping off medicine in rural Africa or an AI scribe or what we're doing. I think that's the core thing. And anyone who's interested in getting into it, it's empathizing with that problem and iterating. Like it's very unlikely that you strike gold the first time or oil, whatever, when you're trying to solve a problem, and you just keep working with people and learning from them. I guess that's been our core approach. And I think this is, kind of one of the questions I've been wanting to ask you, Kieran, is when we were thinking about this webinar, we discussed, how do you build something that people want to use long term? How do you kind of think about that at Heidi, that you're adding value longitudinally rather than just sort of like a snapshot in time?
Yeah. I mean, look, there's no doubt it's a challenging thing to try and think about, right? I mean, that's, I guess, what everyone's trying to, find in the product space is like, how do I build something that, people don't just use for 2 days, don't really engage and then drop off and you never see them again? How do you get people to, sign up, activate, as in like find that value from the product almost immediately, and then stick around because they are continuing to get value. And I think it goes back a little bit to what I was saying before, where that sort of time to like first value, that like time to first aha moment needs to be relatively short, like probably within that first 72 hours of using a new tool. And that's why onboarding is so important, right? You don't want to overwhelm the customer or the client or the user so that they're like, oh my God, this is too much information, I don't have time for this now, I don't have the mental headspace for it now. It needs to be simple, like, hey, this is what we can do for you, let's start off with something simple, so that they don't feel like, oh, this is too much to learn right now. It's enough just to see, it clicks, like I get it. And then over that sort of first 72 hours, it's sort of building like trust and reliability. So it's, I know that this product keeps doing what it's supposed to do. And again, in that process of discovering those other features, you kind of realize, there's power here. It's not just a one-trick pony. We've got all of this. And in many ways, I feel like that's similar to, the therapeutic relationship as well. When you first introduce someone, you don't want, or get introduced to someone or start working with someone, you don't want to, like, as a clinician, overwhelm them with too much. Like, hey, you got to do this homework, hey, you got to do this, you got to do this, and like a bid to show them that you've got all of these features, all these tools. You kind of want to say, right, I just want to show you that I can add value to your life, and this is just a little taste of it, okay? But then invite them to sort of come back and say, well, look, I think we need to explore more together, and then start showing them, right, these are the other bits of value that I can contribute to you. So that every time they come back, they feel like, I'm getting more and more value out of this product relationship session, the more I engage in it. And so engagement kind of snowballs from there.
Yeah, I love that. Because things can feel overwhelming, right? And tech can feel overwhelming at times. Like, what do I do? How do I use it? And, it's got to delight the person and feel that you start and you go on this little bit of a journey. And that can be hard sometimes to create from a health tech company perspective. But it's quite an interesting one. And building in these features that help with retention and engagement, both from the provider side and from the user side. And I think that's really cool. I see we actually have a comment that came through here. We have two, so let me just read them. From a financial perspective of the patient, continuous sessions in person or online with a mental health professional can be expensive and a barrier to seeking help. That's true. The option to do sessions less frequently but stay connected and accountable via the Psyche mental health app sounds like a valuable tool that can really help people who need it. Yeah, exactly. Because not everyone can have that continuous care all the time. So thank you for that.
Yeah.
And then
I think even
do you
just
want to comment on that?
Yeah, like a small comment, because I think the reality is that, mental health care is expensive, right? And I think while people obviously want to try and invest in their own mental health and to work through the problems that they've got, doing that on a weekly basis, a monthly basis even, can sometimes be, prohibitively expensive to someone. And what you don't want is a situation where you spend, a whole lot of money up front to do a session or two with someone, and you get everything out there, and then you realize, wow, this is expensive, and the financial stress is actually making this worse, and so they just disengage completely. And having a way to say, look, I'm going to work with you so that, with your financial situation, we can still give you the help that you need, keep you engaged, but we still see each other at, a regular interval, so that they don't drop off completely and you never see them again, but it's not causing financial strain to the point where actually, the therapy is having, well, hopefully never a net negative impact, but, having a slight negative impact because it's, I feel like I'm getting better, but I'm stressed because, now I can't afford or whatever else.
Yeah, exactly. And we try to solve that in a few ways. So obviously we try to price our products as low as possible, especially for developing countries. And we appreciate that, some of our early users was a clinician that worked in the state and would see people from really low income communities and would only often see them once. And the app was something that she could provide to these people to use, knowing that they probably weren't coming back. And if they were, then fantastic, they get to use it together and whatever. And that was awesome to know that. And we have a model where people can, pay for it and use it themselves. And we have also a fairly generous freemium model, which is just another way we're trying to drive impact. I see we have another comment here. A lot to get through. I really appreciate you guys sending these through. I tell my clients that nobody leaves my sessions without homework. However, as you say, there's a compliance problem and the associated guilt, etc. I can set myself reminders to send a message to the client and ask them how they're doing. Can you suggest enhancements to the system? Which tools and value added? Well, obviously, I can suggest mine. But I'd be wary of suggesting a specific tool to you without doing some research. So I'm happy to go have a look into this. And it is a challenge, right? You want to create boundaries and you want to support, but you don't want to overreach. And there's different ways to do that, right? So like, obviously we help with skills. It helps with the homework thing and reminders. That's also one of the benefits of the app, is it gives people reminders to stay engaged with the process and keep their mental health journey top of mind. But in terms of tools for reaching out to people, I don't want to give specific recommendation. I don't know if Kieran has a great one on the top of his mind.
Look, I can give a recommendation. So look, Heidi is kind of in the process of trialing out a new feature, which is definitely not specific to the mental health care space. And again, it's more just, a way to relieve that administrative burden, which the commenter has alluded to. Because setting yourself reminders to message clients, I know what it's like to have a million different alarms in my phone, which I've given labels, and then they go off at random times because you say, set it every Wednesday. And that can just be disruptive as well, especially if you're in the middle of something else. And one of the features we're building is to have essentially an AI agent that can do calls for you. And essentially it's, speech to speech, or voice to voice. And the idea is that you can, set and dispatch an agent to, call one of your clients or patients to remind them about something, or to, ask them to book in and stuff like that. Now, again, perhaps not at this stage, AI agents still sounds quite robotic, and the main use case for us is just to help, with that administrative burden of, hey, I need to send a follow-up or ask a question or get somebody to book an appointment. And I think it probably needs a little bit more, I guess, deeper and more empathetic touch than a computer calling you in the mental health care space. But maybe that's like a good thing to actually circle back, Dan, because I'm interested to know like how you guys have thought about kind of building like empathy in the way your like product is designed. Because, for us, it's just, hey, click a button, record the conversation or transcribe the conversation that you have and generate a note. Like it's quite, I wouldn't call it cold, but it's engineered. It's a product that serves a specific purpose. It's like a hammer. A hammer is a hammer everywhere. Whereas, for you, you're obviously dealing with a much more sensitive environment. And yeah, I'd be interested to know like how you guys have thought about bringing like the empathetic side to the way you've designed your product.
Yeah, that's a great question. Sure, it's got a long answer, but I'll try to get through it. So there's a lot of considerations that were made when we were building what we're doing, right? And I think it comes also relates to one of the questions, which I promise we'll get to. So there's language, there's culture, there's age, there's literacy level, there's all these considerations around thinking about, who is our user and what do they need. And the way that we've tried to go about doing it is maintaining literacy levels at like a 8th grade reading level. So it's easy to engage with. Even if you're Mr. Professor or whatever, you're still getting the same kind of value out of somebody who's, entering high school, because that's who we've designed it for. So 13 and up. And then we also have a broad range of content because we appreciate that, like I often joke, I know yoga is great, but I don't know if I'll ever do yoga. Like we appreciate that people want to learn and do different skills. Nothing against yoga, just an example. So that's another thing is trying to give diversity of experience. And then our assessment is non-diagnostic. We're not labeling people as being unwell. And this also came from, speaking to different stakeholders. We spoke to the Western Cape Health Department and a few other role players around, if we create a diagnostic tool and we label people as being unwell, if we can't refer them to services, that's a huge ethical problem. So there's all this ethics that we've considered as well. And what if somebody comes in and identifies that they're struggling? So we built in a helpline function so that people could find, reach out to Lifeline or SADAG in South Africa or your equivalent in your country, because our users are in 85 countries. But it is somewhat impossible to make something 100% perfect to you. And people will take different things from the experience. So look, there's lots of things we've considered. We try to have a diverse team in terms of how we build our content, and we do a lot of user testing to understand, because I see something one, or our team sees something one way, and the user might see something another way. And this is true whether you're a teacher or a health tech person or whatever. Like you've got to learn from people. And then obviously, like we're a small little South African startup. We're not rolling in millions of dollars of funding. So we had to keep that in consideration as well. It's like Africa is a diverse, extremely diverse continent with so many different languages. And, we went with English because that was just the most logical starting point. But as we build, like we're building an AI at the moment that will be able to speak in any language. So that's going to start adding more value to people who do struggle with different languages. So, like there's so many things. What about people who are visually impaired or hearing impaired or can't read or write? Like it is somewhat impossible to solve all of these challenges. So we just, we start with, I don't want to say the low-hanging fruit, but the biggest ones that we can, and then we try to iterate and improve and improve. Yeah. Which is sometimes a frustrating answer to hear, but that's kind of the best approach that we can think of and try to do.
You have to build for like the majority of your users, right? I mean, that is I don't get me wrong. I think it's a valiant quest to like build tools that do meet the needs of minority groups in whatever form they come in. And I say this as a white guy who can read, and went to school. But of course, you also need to take into account that you're never building something for an individual. You are building for a group of users. And if anything, I would say it is a fool's errand to go down the route of listening to a single user or a single voice. And probably most importantly, the single voice that you shouldn't always follow is your own, which is quite hard to do when you're a founder. And I mean, look, I can maybe speak to even just some of the mistakes that I made in my own journey as a founder, because I think had I spent a bit more time on like engaging with, the target user and kind of empathizing with their problem, rather than saying, cool, I've got a solution, what am I gonna try like fit it into? So like, we obviously focused on building a tool to help patients quit smoking. And probably the biggest mistake was not doing more engagement and actually talking to users and understanding how they think about their own problem. In fact, I took the typical doctor's approach, which is like, I know what's best for my patients. I'm going to go and read a bunch of literature, and then I'm going to build an app around that, and then, build it and they will come. And surprise, surprise, some of them came, and we did manage to help a few people, but it wasn't a resounding success because we didn't actually spend much time engaging with your user base and trying to understand their problems, their pain points, and then building the solution to solve that, rather than, hey, I've got a solution, let me try and fit it into the problem that you're having. Generally a recipe for disaster. Anyway, I think maybe on that front, kind of a topic I want to talk about, and I'm sure you want to talk about it as well, is I think a lot of people look at something like AI, right, and they see this new technology, and perhaps with it like a little bit of fear. Like, we don't know exactly how it works. We don't know where it's going. The sort of pace of development has, been immense. And I mean, even there's been a few articles that have been released in the last, a little while from people like Microsoft, where it's like, these AIs can make better decisions, do diagnostics better than clinicians. And I imagine maybe in, mental health tech as well, practitioners might feel like, is this tech coming to replace me? So like, how do you respond in a situation where, people are saying, well, is, Psyche there just to replace me? Like, is it going to just perform all the functions that I would perform as a practitioner?
Yeah, that is a great question. I think there's a lot of fear and uncertainty around job security and what tools are doing. And so before I answer that, I want to go back to something you were saying. And speaking to users is super important, right? But they can say things like, oh, I want music in your mental health app, because like, who doesn't like music, right? But the same argument can be made for your banking app. Like, they don't play you music. Banks have billions of rands. They're not putting music into your app. So there's some considerations that you have to think about. Does it really add value or doesn't it? Like, because scope creep is a huge thing when trying to solve a problem, right? And then I think another challenge is like, the person who was riding the horse, if you ask them like, what was the solution to your problem in the stage where like cars was, quite a few, years in the future, they weren't going to say an automobile. They were going to say like a better horse, right?
Yeah.
So sometimes you do need a leap, and people don't know what they want until they get it, right? And then, there was all the people who made the horseshoes and made the horse carts and whatever. Yes, they slowly lost their jobs to the auto industry, and things changed, and they picked up different skills and whatever. That's a huge leap. But I kind of think about AI in a similar way. And this is not my great idea. I heard somebody else say it. But I don't think AI or any digital tool is here to replace somebody. I think what it will do is it will separate those who do use tech to improve their work and those that don't. I use a range of like this new streaming platform. I chose it because it's cheaper and hopefully better than the one I had before. We're constantly doing that. So yes, I think in a lot of places you might not have to use tech, but my argument is often, if it makes your life easier and it makes it better and makes you better at your job and gives you more security, I would, give it a try. A lot of these tech companies are started by, well, I'll speak for myself and Heidi, like, we're trying to make the world a better place. We're not trying to steal people's jobs or, oppress people. That was a bit intense, but that's how I think about it. Is we're trying to save people time and add value, and AI. Well, our approach is to supplement what people are doing, not to replace people. Though I'm sure there actually are people who are trying to do that. So in some ways, it is a valid fear. But stay clear of those companies and those people trying to do that.
Yeah.
So there's a balance, right? Not everyone is pro-social and trying to do the right thing. So to say that fear isn't valid at all is not true. But for the most part, if you're going with reputable companies that are really trying to add value and solving your problems, then dip your toe in, try something new, try the tools. If you don't like it, try something else. Or, make your mind up for yourself is kind of my suggestion.
I mean, in many ways, it's kind of, future-proofing like your own career, that, yes, it may not be replaced, but the way in which, a clinician practiced 10 years ago, 20 years ago is probably very different to the way it is now. So, the job may not be going away, but it's probably changing and evolving. And with it comes a need, much like, continuing medical education, one needs to keep up with the latest developments in order to stay current. It would be negligent if you hadn't done CPD for, 10 years or so. So it is in much the same way. While this isn't necessarily CPD, embracing and learning about these tools is going to, do a lot to ensure that you are a better clinician and hopefully end up benefiting your patients more. I see there's a question from Pabalo in the chat, just talking about different languages. I can maybe chat very briefly to Heidi and to what Heidi's trying to do on that front, and then maybe pass back to Dan. So it is a challenge. That a lot of these tools are very English centric. You even look at a tool like ChatGPT. The vast majority of the internet is essentially in English, which means that a lot of the training data is in English. I don't know how much of ChatGPT's or any other large language models training data is Xhosa or Zulu or any other number of African languages or languages across the world. And the reality is that often means that those population groups or people who speak those languages are excluded. On Heidi's front, we've sort of tried our best to recognize that there are, clinicians out there who, may speak English as their sort of primary medical language, but that they are able to speak Xhosa or Zulu or Afrikaans or Mandarin or Persian when they engage with their patients because they're bilingual or trilingual. And one of the features that we've worked quite hard on is to actually manage multilingual conversations or conversations in English or Zulu and Afrikaans, so that you can have the input to Heidi be in that foreign language, but still have the output generated in English, which you need to then put into your medical record because that's maybe the standard that's being used there. In the same way, you may have the conversation in Persian, have your notes generated in English, and then you want to give a patient explainer to your patient. You can then use something like Heidi to generate a patient explainer in Persian, which you can print out or email to your user. The caveat is always that, we're not here to be a translation device. So if you don't speak the language, it's very difficult to then verify that if you produce a patient explainer in Persian and you can't read Persian, there is a risk in giving that to someone. So, our encouragement to everyone is like, if you are bilingual, then take advantage of those. Anyway, that was just a small digression to answer Pablo's question there.
Yeah, thanks for that, Kieran. I appreciate it. And I'm loving all the comments coming through. Thank you, Susan, about saying, I love you saying it's a supplement. And Hillary, I'm so happy to be here and gaining great insights. I'm really pleased to hear that. Mate, thanks for joining us. So I think as we start wrapping up, Kieran, I think people might want to, like if they had a little checklist, what should they consider when choosing a digital health tool that they bring into their practice or their healthcare industry? Like, are there a few things that they should look at and consider?
So look, I mean, I won't speak for all clinicians, and I will try and keep this tailored to the mental health care space, because there is no one size fits all tool that works for everyone. Ideally, what you've kind of got to work out beforehand is, okay, how do I practice? And what are the things about the way that I currently practice that are either time consuming or just a pain point for me? And those are usually the points where I'm like, that's where you should be looking for some form of tool. For me, my attention span is that of a flea. So trying to take notes and remember that I've taken all the right notes, for me, it's an obvious thing that I want a tool that can take over my note taking. Same thing with letter writing. Like, I'll get stuck trying to find the right wording for a letter because I'm like, it needs to be perfect. And then next thing you know, you've spent 30 minutes or 45 minutes on a letter. And again, if I know that I can reduce the amount of time I spend on documentation, meaning that I can spend more time seeing, clients or, with my family at home, then that's a pain point that I want to solve. For other people, it might be, you want to be able to like jot down notes on, while you're talking to a patient. For you, it might be, you need to have some form of tablet and something where you can, transform handwritten notes into digital notes. So if anything, it's not so much go out and look for these tools. It's more like look at what you are currently doing in your practice. Where are the bottlenecks? Where are the pain points? And then go and look for ways to solve that problem. Again, we shouldn't be looking for solutions to retrofit into a problem or maybe even an imagined problem. You need to actually understand the problems that you have or the pain that you have, and then go look for the right solutions to go. So yeah, that's my 2 cents on it, just looking at it from a product lens perspective.
I love that. Solving the right problem. And making sure that the tool is appropriate for it. And I guess the things that I would add to it is, where relevant, is it evidence-based? Is the company trustworthy? Do you know what they're doing with your data? And you can read these things and you can ask the company these questions if that's a fear you have. And just, making sure that it fits your approach and is appropriate. We have a question here for you, Kieran, as we round this up quickly. I have a question for Kieran. In your experience with Heidi, how do clinicians explain the use and ensure confidentiality when sessions are recorded? I see how recording, sorry, that jumped for me. Confidentiality when sessions are recorded. I see how recording what is said is super helpful in saving time, but I think some clients may be skeptical or some even refuse sessions during being recorded.
Yeah, absolutely. So it's a question we get all the time. And I think the big distinction I always make up front is that we don't like record and store the audio. So what we do is we transcribe in real time. So we produce a transcript from the speech between the clinician and the patient or whoever else is in the room. And then once that transcript has been created, the audio essentially disappears. So it sits in temporary storage, cache, as you might call it. And essentially, once that transcript has kind of been validated, that it's completed, that transcript gets added to the database, and then essentially the audio disappears after that. So that's kind of how we address that particularly. I think for a lot of patients, they may still think, I don't want transcripts of my conversations with my therapist sitting online. And so what we do is we essentially have a setup that, once data is deleted from Heidi, it's gone forever. So in a medical record situation, they've got essentially like obligations to, maintain medical records for certain lengths of time. We say that Heidi is more like an information, production engine, or information generation or documentation generation engine. And what you can do is use Heidi to generate your notes or your letters, transfer that across into permanent storage, like an electronic medical record, and then just delete your session off Heidi. And a lot of our clinicians essentially have, 24-hour data retention. So they do their sessions on Heidi, they transfer it across, and then after that it disappears. That being said, a lot of clinicians have actually come back to us, again, sort of saying, oh, we had these concerns. But the vast majority of patients actually generally accept, because in their experience with having people using AI scribes so far, they've actually said, my provider is so much more engaged and present in the session because they're not typing and writing notes. I feel like I'm getting so much more out of the session. And so while they may have that concern, that the trade-off that, I know that the provider is doing what's right for me and I'm getting more engagement, they often feel that actually I'm not that concerned at all because I'm benefiting so much more. So a very long answer to your question, Susan, but hopefully that's answered your question.
Thanks very much. It's been an absolute pleasure having you, Kieran. We've whizzed through our hour together. I hope we added some value to people wanting to know a little bit more about the health tech space and how we're trying to build solutions to improve mental health outcomes and improve healthcare providers and their clients' lives. If you have any more questions, please leave us some comments or reach out to us via email or find us online. We'd love to engage with them some more. So thanks very much, Kieran, for being here, and thank you to all our guests for taking some time to join us. It's been a pleasure.
Yeah, thanks, Dan. This has been a great conversation, and as I said at the beginning, always nice to connect with fellow South Africans who've been on the founder journey, the health tech journey, and I guess I've deeply invested in kind of trying to solve these problems for users, whether they are clients, patients, practitioners alike. It's been a pleasure, and look forward to catching up with you again at some point in the future.
Fantastic. Thanks, everyone. Cheers.